Hi and welcome. My name is Rute and I'm a medical doctor. I'm a general practitioner. Thank you so much for tuning in. Today I'm going to talk about feminine hygiene. So I'm going to give you some feminine hygiene tips. And the reason I'm doing that is it's important for us to look after ourselves because that can help reduce the chance of getting things like thrush or bacterial vaginosis. I already have videos uploaded on the channel about thrush and bacterial vaginosis, so please feel free to have a listen to these once you finish watching this video. Before I get into the tips, I want to make sure that we're on the same page. So when I'm talking about the vagina, I'm talking about the inside, not the outside. So the outside is the vulva, so that's where the labias are. So you've got the labia minora, so the inner lips, and then you've got the labia majora, so the outer lips. So when I say the vagina, I mean the inside. I know there's quite a lot of pressure out there about having the perfect looking vulva or vagina, having the perfect type vagina, having the perfect smelling vagina, and these pressures can lead us to doing things that might be harmful to us. On that note, my first tip is do not clean the vagina. Remember, I'm talking about the inside. So the vagina is designed in a way where it cleans itself, and you can see that when you're getting discharge through different parts of your cycle. So you don't need to clean the vagina, whether it's with water, whether it's with soap or salt or lemons or garlic. It does not need cleaning at all. It will do the cleaning itself. You cleaning it and putting different things in the vagina to clean it will disturb the normal vaginal flora, and this can lead to a change in the pH and an increase or overgrowth of bacteria, which will now lead to things like bacterial vaginosis or thrush. Another tip is do not douche. We do not recommend douching as medical doctors because of the same reasons that I have described. So that's in relation to the vagina. So now when we get to the vulva, so the outside, so in relation to the vulva, again, you don't need to use strong scented soaps. You don't need to use deodorant. The vagina has a natural scent. Or the vagina or the vulva has a natural scent. So you are going to have an element of a scent. Now that scent is not a strong scent. It's just a scent that is individualized to different people. So if you do have a strong scent, that might indicate that something is not right. It's important to wash the vulva, and you can do this with a cloth, with your hands, with an unscented soap, so a mild soap. So it's the strong soaps that we don't recommend, but you can use a nice mild soap to clean the vulva. And you can use moisturizer, again a light moisturizer, not something that is strongly scented, because that again can cause a disturbance of the normal vaginal flora. So the other things that you can be doing to reduce your chances of getting yeast infections or bacterial vaginosis is making sure that you are wearing cotton underwear. Cotton underwear is really good at absorbing the sweat, so then it reduces the chance of you getting moisture there, which can increase the chance of bacterial overgrowth. So you want to make sure that your vulva is dry as much as possible. So after a shower or a bath, make sure that you dry it well. Make sure that you keep it dry. Also, if you've gone swimming, make sure you keep it dry. And also, after using the toilet, making sure that you're wiping from front to back. 1, wiping keeps it dry, and 2, wiping from front to back means that you're not getting any bacteria from the back going to the front. Some people ask, how often do I need to be washing my vulva? As we've already said, we don't wash the vagina. The vulva at least once a day. Once or twice a day is enough. You don't need to keep washing throughout the day because that can cause irritation. So when you're having a wash or a bath, so if it's once or twice a day, that's good enough. And my last 2 tips. So the first one is get to know yourself. Get to know how your vulva looks like. So get a mirror, have a seat, and have a look, so that if anything changes, you will be able to notice it and you'll be able to book an appointment with your GP and say, look, this spot wasn't there, this rash wasn't there, this wasn't there, it doesn't usually look like this, it's more swollen than usual. It's okay to know how your vulva looks like, and that's really important. And my last tip is making sure that you go for your cervical cancer screening. Here in the UK, you will get an invitation letter to make sure that from the age of 25, you get regularly screened for your risk of getting cervical cancer. So make sure when you get that invitation that you go and that you continue going when you get an invitation. I have a more detailed video on cervical cancer uploaded on the channel, so make sure that you go and check that out after this video. So thank you so much for watching this video. I hope you found it useful. Until next time, it's bye from me.